This medicine is used to treat specific eye issues caused by inflammation or injury. Fluorometholone helps to relieve symptoms like swelling, redness, and itching. It is a type of drug called corticosteroids. It is usually applied to the affected eyes 2 to 4 times a day, or as directed by your doctor. The best time to take it is in the morning and/or evening. Be sure to follow your doctor's instructions carefully. If your doctor allows you to wear contact lenses while using this medication, be sure to remove them before using the eye drops. After applying the drops, wait at least 15 minutes before putting your contact lenses back in. When applying the eye drops, wash your hands first and shake the bottle well. Avoid touching the dropper tip to prevent contamination. Tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Place one drop into the pouch, close your eyes for 1 to 2 minutes, and apply gentle pressure at the corner of your eye to prevent the medication from draining out. If you are using other eye medications, wait at least 5 to 10 minutes before applying them. Use this medication regularly at the same time each day to get the most benefit. The dosage and length of treatment will be determined by your doctor based on your medical condition and response to treatment. Do not use this medication more often or for longer than prescribed, as it may increase your risk of side effects. If the medication becomes contaminated or if your condition does not improve after 2 days, contact your doctor. And remember, do not stop using this medication without consulting your doctor as it may worsen your condition. When applying FML suspension, drops, you may experience stinging or burning of the eyes for 1 to 2 minutes, as well as temporary blurred vision. If these effects persist or worsen, be sure to inform your doctor or pharmacist. This medication has been prescribed to you because your doctor believes the benefits outweigh the potential risks. While many people do not experience serious side effects, prolonged or high-dose use may lead to eye problems such as high pressure inside the eyes and cataracts. If you notice any vision problems or eye pain, contact your doctor immediately. FML suspension, drops may mask the signs of an eye infection and increase your risk of developing one, especially with prolonged use. Be sure to report any new or worsening symptoms, such as eye discharge, swelling, redness, or vision problems. If you experience no improvement in your current eye condition, your doctor may need to adjust your treatment. Contact your doctor right away if you experience any serious side effects, including headache or dizziness. While a serious allergic reaction to this medication is rare, seek medical help immediately if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to consult your doctor or pharmacist if you notice any other effects. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using FML suspension, drops, it's important to let your doctor or pharmacist know if you have any allergies or if you have a history of certain eye conditions, such as infections, recent surgery, cataracts, glaucoma, severe nearsightedness, or diabetes. After applying this medication, your vision may become temporarily blurry, so it's best to avoid activities that require clear vision until it's safe to do so. If you're planning to have surgery, make sure to inform your doctor or dentist about all the medications you're using, including prescription drugs, non-prescription drugs, and herbal products. If you develop a new eye infection or injury, or if you need eye surgery, consult your doctor about whether you should continue using the current bottle of FML suspension, drops, or start a new one. If you're pregnant, FML suspension, drops should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. It's not known if this medication passes into breast milk, so it's best to consult your doctor before using it while breastfeeding. And remember, always follow your doctor's instructions for the best time to take this medication and the correct dosage for your condition. It's important to be aware of potential drug interactions when taking FML suspension, drops. This can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for immediate medical help. In the U.S., you can contact your local poison control center at 1-800-222-1222. For residents of Canada, you can reach out to a provincial poison control center for assistance. Always keep this medication out of reach of children and pets to prevent accidental ingestion. This medication is prescribed specifically for your current eye condition and should not be shared with others. Do not use it for any other eye condition unless specifically instructed by your doctor. Your doctor may also recommend different medication for a different eye condition. While using this medication, you may need to undergo lab or medical tests such as eye exams or pressure measurement inside the eyes. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and continue with your regular schedule. Do not take double the dose to make up for the missed one. When using FML suspension, drops, it's essential to follow the storage instructions provided with the product package or by your pharmacist. Avoid freezing and storing in the bathroom. Keep the bottle upright and tightly closed when not in use, and always keep medications out of reach of children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.